Good day, I am Quinzel Himarino Limbuan, your student nurse from University of Mindanao. Check the doctor's order. Catheterization is only if with medical's order. Assess whether the client is allergic to iodine or plaster. Okay. Povidone iodine is often used to cleanse the vulva before the catheterization. Assemble equipment needed. Organization promote time management. Identify and explain the procedure to the client. Hi sir, may I know your name? Okay, Mr. Trinidad. So I am Queen Zaliwan, your student nurse for today. And for today's procedure, sir, what we're going to do, I'm going to insert the catheter to your urethra opening of your penis to drain the urine into your bladder. Ensures the right client and illicit cooperation. Provide a good light. Good lighting is necessary to locate the meatus clearly. Provide privacy by screening and closing windows and doors. The client has the right to be protected from being exposed to others. Replace client top sheet with bath blanket. Place waterproof underpad under the client.
Okay, sir, I'm going to replace your top sheet with bath blanket. And I'm going to place the waterproof underpad. Can you turn to the other side, sir?
This protects the bed linen from getting soiled and moisture. Place the client in supine position with feet apart and drape the client. So sir, I'm going to help you to sit. And I'm going to drape and going to separate your legs. And now I'm going to drape you so to expose your penis. Good visualization of the meatus is important. Embarrassment, chillness, and tension interferes with the introduction of the catheter. Prepare the urine receptacle and tubing if an indwelling catheter is to be inserted. The tubing facilitates in connecting the catheter to the drainage system. Open the pack and bring it near to the perineal area. Observe aseptic technique. Let's assume that this is our catheterization pack. So we already bring it to the client's bedside and we're going to open it. First is away from us, to the side, and to the other side. So observe receptacle, aseptic technique rather. Placement of the equipment near the worksite increases efficiency. Sterile technique protects the client and prevents the spread of microorganisms. Place a small amount of lubricant over the sterile OS and place it over the sterile field. Organization promote efficient time management. Using sterile pick-up forceps, get 2 cotton balls with betadine antiseptic solution from the sterile jar and place on the sterile field on the top of the several OS. Open the wrapper plastic cover of the sterile specimen bottle and drop it on the sterile field. So with the use of our pick-up forceps, we're going to get 2 cotton balls and place it on the sterile field. And we're gonna pour a small amount of the lubricant, the betadine solution, to our cotton balls. And our sterile bottle, we're going to open it and place it in the sterile field also. Wash hands and put on working gloves. Do perineal care flushing, then discard working gloves after cleaning the perineal area.
Wala.
Hand washing prevents the spread of microorganisms. Cleansing the perineal area prevents the introduction of bacteria. Put on sterile gloves. Grasp the upper corner of the fenestrated of eye drape and unfold it and place the fenestrated drape aseptically over the perineal area with the penis extending through the opening. To avoid cross-contamination of microorganisms, a drape provides a sterile field where the equipment and hands will be placed. Prevent accidental contamination from adjacent areas. Holding the penis with non-dominant hand, disinfect the meatus twice using cotton balls with antiseptic solution. Starting from the top, use a circular motion stroke, then downward for each cotton balls and discard. With the use of our non-dominant hand, we're going to hold the penis. And we get a cotton balls with betadine solution and cleans the penis with circular motion. And discard. Then get a new one. Then discard. Cleans the area and minimizes the risk of urinary tract infection by removing surface pathogens. Lubricate 6 inches of the catheter tip. So, na lubricate the tip of our catheter. So, like that. Lubrication facilitates the insertion of the catheter and reduces trauma to the tissue. Hold penis perpendicular to the body and pull up gently. So we're going to hold the penis and pull up gently. Hold the catheter. In the dominant hand, steadily insert the catheter about 8 inches until urine is noted in the drainage bag or tubing. Advancing an indwelling catheter on an additional 1/2 inch to 1 inch ensure placement within the bladder and facilitate inflation of the balloon if Foley catheter without damaging the urethra. Okay, sir, so now I'm going to insert the catheter. So as I am going to insert the catheter, can you take a deep breath? Okay. Do not force the catheter through the urethra. Ask the client to take breath deeply and rotate the catheter if slightly resistance is met. The sphincter relaxes and the catheter can enter the bladder easily when the client relaxes. Hold the catheter securely with your non-dominant hand while the bladder empties. Collect a specimen about 20 to 30 ml if required. Continuous drainage according to hospital policy. Remove catheter slowly and smoothly if catheter is used. The catheter is only needed to drain urine present in the bladder and is not intended for continuous use. If a Foley catheter is used, introduce a 5 cc or follow manufacturers. Secure the catheter, gently pull the catheter until the retention balloon is nuggles against the bladder's neck. Remove the fenestrated drape. creates a balloon to ensure catheter retention, maximizes continuous bladder drainage, proper attachment prevents trauma to the urethra and hiatus from tension of the tubing. Attach catheter urine bag below the level of the bladder. Tape the catheter in the lower abdominal area. To avoid reflux of urine to prevent infection UTI. Remove and clean the equipment, make client comfortable, label the urine specimen and send it to laboratory promptly. Okay, sir, now I'm going to remove your bath blanket. Urine kept at room temperature may cause organisms, if present, to go and distort laboratory findings. Wash your hands. Hand washing prevents the spread of microorganisms. Record the time of the catheterization, the amount of the urine removed, a description of the urine, the client's reaction to the procedure, and the other observation. A careful record is important for documenting data after the client's care. The reporting and recording of information about the procedure must be accurate and timely for continuity of care. Thank you and God bless us all. This is Quinzel Limbuan, your student nurse, signing off.